What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. I wanted to do this episode on my thoughts for the past AAPM&R, the American Academy of Physical Medicine and Rehabilitation Annual Assembly, which was this past weekend in San Diego. And last time I was at an academy meeting was in 2015, which is pretty crazy because I was very, very active in the academy, even as a medical student. Life kind of obviously gets in the way and things get busy, and so it's definitely been a while since I've been back. But I wanted to share some of my thoughts. This is the first time I attended this assembly as a mature attending, and 1 year into my new practice, which is no longer taking insurance, and I'm strictly doing direct care with musculoskeletal medicine. So it was definitely interesting, catching up with everybody. Some people I haven't seen in literally, maybe 10 years. And, getting back to the academy brought up a lot of thoughts. And as I was looking through the agenda and the various courses that I could go to, the ones that I was really drawn to were actually the mentoring ones, and even the resident ones, to be honest. Uh, in my earlier part of my career, I was very involved in academics and mentoring, working with medical students and residents, both on the local and even the national level. And it brought me back to what really drove me on mentoring and teaching has always been a passion of mine, and I kind of lost that along the way. Just as I started going into private practice, I, essentially just kind of stopped being as involved, and coming back to it, going to some of the lectures, meeting residents and medical students really, kind of sparked some fire, some enthusiasm again. And now that I am in the phase of my career where I'm trying to not only create the practice that I want, I'm trying to create the life that I want as well. I think I'm going to have to get back into um, mentoring again because it felt really good. Now, aside from the lectures, what I really took away was I enjoyed the conversations, connecting with people again. I attribute some of that to the burnout over the past decade. But my only way to stay connected to patients, unfortunately, was to essentially kind of become less connected to anything else. And that included, some of the relationships I've developed over the years. And, it was really nice to reconnect with people again. One of my favorite lectures was actually towards the end of the conference this past Saturday. And the title of this particular workshop is Are You Happy in Your Practice? And, that is really, I guess, the primary question that I've had that led me to opening up my own practice. I went to the session, and it was, as I expected, kind of sparsely attended. It's towards the end of the conference. It's late in the day, but at the same time, it was attended. And as I was looking around, there was people in various stages of their career. I would venture to say that there was maybe one other person that had less than 10 years of experience that was in the room, myself included. So the rest of them were probably mid to late year career folks. And the lecturers included Dr. Atul Patel and also Dr. John Cianca, which was moderated by Dr. Sarah Wang. And they both shared their experience, what led them to designing their own practice. Dr. Patel shared his story from going away from academics to become more academic in a private practice, and he's been very happy and successful in his career or his post-academic position in private practice. And he continues to be very active, not only publishing research, but also with leadership. And then there's also Dr. Cianca, who has fortunately been very gracious in sharing his knowledge with me over the years. Looking back at my email trail, I picked his brain on how to create a outpatient musculoskeletal practice that is not insurance based. And I finally get a chance to meet him in person, shake his hand, and say thank you for helping mentor me. But the are you happy? It is really, I think, the main question that any clinician needs to ask themselves. And from my standpoint, being happy in your practice really comes down to two questions. Number one is what actually makes you happy? And number two, what are your goals? And these two questions are a good starting point, I think, for any person at any point in their career. You don't necessarily have to be towards the tail end of your career to start asking yourself this question. My concern with is that probably like myself, I didn't really like to ask myself that question because I was afraid of the answer. And looking back, I really avoided it for a long time. And eventually, I confront myself with the uncomfortable question. I journaled a lot about it, and I really had to set aside some time to think about what makes me happy. Even when I actually quit and I had some time to really step away from the insurance-based model, there was kind of a period where I just had to sit with my thoughts, and finally a lot of my goals became a lot more clear. What made me happy also started to become much more obvious. It's interesting when I was in my old position in that old world of insurance-based medicine, it was almost like I was in a fog. It wasn't as obvious. And it wasn't until I actually stepped away that it's like my brain woke up. All of a sudden, the fog had lifted and things became a lot more clear. So it got me thinking, maybe if I was in my old position, if I had more time to really step away and think, maybe my career might have lasted a little bit longer. But to be honest, even if it did, I'm so much happier on the other side of it that I really came away very empowered listening to everyone's story that I had actually made the right decision in stepping away and following my own path. And a lot of the questions after the lectures were completed were, you know, obvious. A lot of them were surrounding questions about, well, opening up any practice, let alone a cash-based practice, is difficult, especially as a young graduate. You have all these loans, you may have family, you now have the task of trying to learn how to become a business. That's just not something that we do in medical. We have so much to learn, let alone a whole nother endeavor. And so the question obviously from the crowd was, well, how do you do that? How can you take on this financial risk and, having a young family, having loans to pay, having a mortgage, having a car, and then all of a sudden you're going to try and just do this on your own? And I think that is a fair question. It's probably the most obvious question, and maybe even the most important one, is how. The problem with how is that it limits you, and it limited me for a long time. I constantly asked myself, well, how do I do this? How do I do this? And it was just never ending. So, when I heard that question in the crowd, I immediately followed it up. Well, if you're going to ask how, I think you need to also follow up with, if not now, then when? When is the appropriate time for you to create the career that you want? It's not to say that everyone has to leave and go into a cash-based model. This is, really about finding what makes you happy in practice, because what makes you happy in practice will also lead to a happier life and vice versa. That is exactly what happened to me. But I think it's important that you do have a plan as a young attending, because if insurance-based med is for you, then great. But if it's not, you should have a plan. And it often surrounds, what is your financial plan? How do you get out of this? Keeping that in mind is also helpful as you start to spend the money that you're now earning. Is some of that money going towards your exit strategy? If you don't have an exit strategy, then it makes it all that much more difficult when that time comes, because all of these how questions, they never go away if you don't think about them. So the next question after that is, what would it look like? For me, that has really been a transformative mindset, because how, to me, always sounds impossible. But when you start to ask yourself, what does it look like if you were to leave your job? Or what does it look like when you have a solo practice? Now you're starting to imagine. And that's not to say that it's not hard, it's not scary, because both of those paths of staying versus going are both hard and scary. But I think when you chase your dream or chase what you want, there's other emotions that go along with it: excitement, enthusiasm, passion. I don't think that those same emotions go with, a path that you've already taken if you're unhappy. I think it's just a different way to look at it, because fear and things being difficult are always part of the equation, but that are hard to do or have a lot of risk, they always seem better when your incentives align with the overall goal, which is to be happy, which is to practice medicine the way that you want to. If you can start to see yourselves lining up with the fear, but with the passion, with the goal, things start to actually become more clear. And so that was really my takeaway from this past lecture. It was that there is a way. I'm glad that these assemblies occur, and particularly that this lecture happened, because I hope that the Academy does ask me to present next year and be on a panel, because I think it's important not only to the field, but for physicians out there, that they see that this thing is possible. Right now, there was only 2 presenters, but I personally know at least 5 or 10 different people doing something fairly similar, and we're all doing it differently. As an audience, as the audience sees, like, wow, there's 10 different people and there's 10 different paths. What if my path is number 11? I think that would be amazing. Absolutely amazing. Or maybe someone says, hey, I like the way that, the presenter number 8 did it. I'm going to do it that way. At least there's a pathway forward. And, I really came away just feeling very grateful that I listened to myself, and I took a risk, and that my family, my wife, my kids supported and trusted me. It took an enormous amount of trust on my wife's part and my family's part, not just that I trusted myself. So I need to remind myself of that sometimes. But anyhow, I thought that it was an amazing experience. I'm super happy that I went. Again, my takeaways from it are, I'm going to get back into mentoring again. I hope to come back next year, maybe as a presenter next time, so I can share my experience, share my journey, and hopefully pave a path towards a direct care model for those that are looking for it. Thanks again for listening, you guys. I'll see you next week. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, Make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.